Hello, I'm Jurjen Boonstra, gastroenterologist and interventional endoscopist at Leiden University Medical Center.
And I'm Richard Dung, medical student and researcher at the Department of Gastroenterology and Hepatology, Leiden University Medical Center.
To start, we would like to thank all patients who have participated in our study.
And on behalf of our co-authors, we would like to thank GIE for the opportunity to discuss our article entitled Quality of Life and Fear of Cancer Recurrence in T1 colorectal cancer patients treated with endoscopic or surgical tumor resection.
With the introduction of population-based screening programs worldwide, the proportion of patients diagnosed with early invasive colorectal cancer has been vastly increasing. Currently, therapeutic decision-making for them is mainly based on the risk of lymph node metastases and the risk of treatment-related adverse events. However, it's very difficult to predict the presence of lymph node metastases and to determine who should or should not undergo surgery. In practice, negative lymph nodes are found in about 80% of all patients referred for surgical resection, indicating that surgery has not provided additional oncological benefit in these cases. So, as an accurate weighing up of oncological benefit versus treatment risks remains challenging in T1 colorectal cancer patients, eliciting the patient's perspective becomes especially important. In other words, optimal decision making not only involves balancing aforementioned factors, but also considering relevant patient-reported outcomes such as quality of life, fear of cancer recurrence, and perceived time to recovery. However, empirical data on patient-reported impact of different treatment options for T1 colorectal cancer are lacking in scientific literature.
In this cross-sectional study, we have evaluated patients' quality of life, perceived time to recovery, and fear of cancer recurrence after endoscopic or surgical treatment for T1 colorectal cancer. To this end, we have sent several validated questionnaires on the same date to all patients with T1 colorectal cancer in Leiden University Medical Center or Isala Hospital Zwolle, the Netherlands, between 2014 and 2017. In total, 119 patients fulfilled our selection criteria and thus received a questionnaire. After collecting all filled-in questionnaires, we were surprised by the impressively high response rate of 92.4%. It was especially satisfying for us to see that patients were very enthusiastic about our study. Some patients even wrote back that they were so happy to participate in a project which uses outcome measures from the patient's perspective. The main finding of our study was that endoscopic treatment provides a quicker recovery than surgery from the patient's perspective. Compared with the surgery group, we found that the perceived time to recovery was on average 3 months shorter in endoscopically treated patients after adjustment for confounders. Moreover, we also found that there were no significant differences between the endoscopy and surgery group on quality of life and fear of cancer recurrence.
The clinical implications of our study can mainly be thought in providing quantitative measures of relevant patient-reported outcomes which can be integrated in the process of therapeutic decision-making. This is especially of great importance in the absence of a clear indication for surgical or endoscopic treatment. Treatment counseling for these challenging cases, we can now also provide scientific data on patients' reported impact of different treatment options. For example, we can inform patients about the treatment impact on multiple aspects of quality of life, such as daily functioning, symptom severity, and recovery time. Moreover, it's important to be aware of the fact that endoscopically treated patients do not experience more fear of cancer recurrence than surgically treated ones.
Principal limitation of our current study is the cross-sectional study design, which limits the validity of our results. For example, the time between treatment and date of filling in the questionnaire varied considerably in the study population. Besides, it was not possible to measure quality of life or fear of cancer recurrence of patients at baseline or prospectively at multiple time points in follow-up. Given these limitations, we consider this current study to be exploratory and as a starting point for new prospective longitudinal studies. Currently, our research team is making efforts on prospectively evaluating quality of life and fear of cancer recurrence in T1 colorectal cancer patients.
For now, as we have already illustrated before, therapeutic decision-making in T1 colorectal cancer patients remains challenging in daily practice.
The current model mainly focuses on preventing undertreatment, but leads to a large amount of resections with a suboptimal benefit. Therefore, we strongly stress the importance of eliciting the patient's perspective in therapeutic decision-making of T1 colorectal cancer patients.